typical of cannabis and not found in other plants. It's like, okay, so there's a bit of categorization. So the cannabinoids are these compounds that most people don't realize are actually terpenes. People will like to say, no, terpenes are different. No, cannabinoids are all terpenoid compounds. And I don't have like a screen with a PowerPoint or anything to show people. But when you look at, depending on which side, but like say there's two sides to the molecule, the left and the right side, basically, that one side of the molecule is terpene. It's just a terpene. It basically looks just like myrcene. And the other side of it, where there's a benzene ring, actually I do have a molecular structure in my backgrounds, but I'm not gonna pull it up. That would be really nerdy for me to put it on the screen. But anyway, the other side of it is basically aspirin, salicylic acid. So chemically, on a molecular level, cannabinoids are just unique aspirin, modified aspirin molecules. And then that suddenly makes them sound a lot less mysterious. It's like, whoa, that sounds boring, aspirin. But aspirin is an amazing, amazing drug that is semi-synthetic. It comes from a natural product. They modified it. The Bayer company, most of us English speakers call it Bayer, Bayer. Used to be a chemical company, became a pharmaceutical company because they made acetyl salicylic acid, which is aspirin, which makes it more digestible and less toxic and all these things, supposedly. But this root of it, salicylic acid, which comes from like white willow bark and lots of other plants that are found in different parts of the world, that has these analgesic characteristics. I mean, to realize that aspirin used to be used for labor pains. It used to be the go-to analgesic, for people that didn't have access to opium yet and all those other things. In Western Europe, that, other than ice, the best analgesic that was around for a long time was, other than alcohol, obviously, was aspirin. And so these molecules being closely related to salicylic acid and therefore related to aspirin is amazing. But wait a minute, they have these psychotropic effects, and aspirin doesn't have a psychotropic effect. It's like, okay, well, THC has a psychotropic effect, but CBD doesn't. Well, that's not true. CBD is also psychotropic. It's psychoactive. No, it's not. It doesn't get you high. Getting high is not the same as psychotropic. Psychotropic, the Greek roots of the word, psych means mind, obviously, but tropism is the turning. And so it is something that causes one's mind to turn. Huh. And obviously it's very metaphorical, but it changes your perspective, because in order to change your perspective, you have to change your point of view, that sort of thing. And so people see things differently. And so there's a lot inside of that. So then it's not that psychotropics make you trip, but they make you see things differently. And so that's a super, super interesting characteristic, because many of us could benefit from seeing things differently. And also many, let's say, systems in the world benefit from everybody seeing things the same way. You're in a factory, you're building widgets, you're building iPhones, you're building Tesla cars. They don't want you to get creative, And so anyway, that sort of thing. But it's psychoactive and psychotropic actually mean the same thing. And there's people can look it up online. The World Health Organization official global definition of psychotropic and psychoactive is just any substance. Psychoactive, psychotropic substances are substances that affect human mood and or cognition, either one or both. And so then we can back off from that and say, okay, so like there's LSD, there's mescaline, there's THC, it's like, yeah, but then there's also CBD. No,
That's
CBD. Yeah, but it affects mood, doesn't it? It helps people with depression, anxiety, and stress. That is by definition a psychoactive agent, or a psychoactive drug, you could call it. Antidepressants are psychoactive drugs. Anti-anxiety drugs are called psychoactive drugs, psychotropic drugs. It's not some separate thing. It doesn't require a trip to the rainforest, and it doesn't necessarily mean that you'll meet, teachers from another universe or anything when you take, Valium or what is the with the one that makes people do the sleepwalking? I try to forget these names, but anyway, Ambien. I guess that's why they called it Ambien, because to ambulate in the middle of the night. Anyway, so this issue of what is psychotropism really? What means something is psychoactive? It affects your mood. Well, if you have a companion animal like a cat, and lots of times I'm on these Zoom calls and people have cats that jump on them and they start petting them, well, they undergo a psychotropic or a psychoactive experience because their mood changes, their heart rate will change, their respiratory rate and their respiratory pattern will change. They typically become more relaxed, unless they're embarrassed, in which they can become agitated. That's still psychoactive. Okay, so you don't even have to ingest something for it to be psychoactive. Sunshine is psychoactive, and it's a treatment. Ultraviolet light is a medical treatment for seasonal affective disorder that affects people in places like the UK and Pacific Northwest, where I live in Seattle, where much of the year people don't see sunshine, even though today I've got lots of it. And so, people are like, oh, it's a sunny day. They just change their mood. Sugar is a huge psychoactive compound. Okay. And anybody who has kids, knows it, but all of us were kids at some time, as far as I know. And so that's that thing, after you have ice cream and you want to run around and play baseball, why are those kids running around all the time for nothing? Kids run just to do anything, and older people are like, hey, I'll take the bus, and so that whole space is psychoactive. And the world looks different when you're not depressed. Just ask a depressed person. And the world looks different when you're manic. Maybe you don't want to ask a manic person because they'll talk forever like I do. So to really understand these words and what we're saying, what we're talking about, will help us to then dive deeper into cannabis and what it's doing and what it's telling us and what it may possibly teach us.